Although not ideal, the antecubital space is often used as an IV insertion site in emergency situations. The TLC elbow splint is ergonomically designed to fit the natural shape of the elbow joint while increasing access for easier assessments. This video will demonstrate the application of the TLC elbow splint with straps. Refer to your TLC product packaging to select the correct size TLC elbow splint. The extra-large TLC elbow splint with straps will fit most patients who require a small adult or standard adult size blood pressure cuff. Each splint comes individually packaged and includes an insert with illustrated step-by-step instructions for your convenience. Secure the IV site according to your hospital's policies and procedures. The TLC elbow splint can be applied before or after IV insertion and can be used on either arm. Remove the TLC elbow splint from the packaging and unroll the straps. Identify the concave surface of the splint. The concave surface will make contact with the patient's skin. The removable orientation label indicates proper placement. Remove the orientation label before applying the splint. Place the splint under the patient's arm with the narrow end of the splint toward the forearm and the wide end toward the upper arm. The point of the elbow should align with the center opening. We recommend a thumbs-up application whenever possible. The straps will come pre-attached to the splint. Wrap the strap at the narrow end of the splint at the patient's forearm, secure with Velcro coin. Repeat with the strap at the upper arm, securing with Velcro. Slip one finger beneath each strap to ensure the fabric is not so tight that it impedes circulation or infusion of IV fluids. Protect the IV catheter and loop of tubing with an IV House Ultra Dressing or IV House Ultra Dome. Check the IV insertion site hourly for redness, swelling, and tenderness. Touch, look, and compare the IV site with the opposite elbow and arm. Replace the TLC elbow splint each time a new IV is inserted. No other arm board offers the 360-degree visibility of the IV House TLC splint. The see-through openings allow nurses to touch and compare the underside of the extremity, making it easier to avoid complications. The TLC splint ergonomically supports the area of flexion and makes it easy to touch, look, and compare the underside of the extremity to prevent injury. To order samples of the TLC elbow splint, visit ivhouse.com.